Type 2 diabetes is a chronic condition affecting millions worldwide. It is characterized by high blood sugar levels which occur when the body either doesn't produce enough insulin or cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar levels by allowing glucose to enter cells for energy. Conventional treatment for type 2 diabetes typically involves lifestyle modifications such as diet and exercise and medications to lower blood sugar. While these approaches can manage the symptoms, they often fail to address the root cause of the disease and may come with side effects. Moreover, many individuals struggle to maintain these interventions long-term, leading to a progressive worsening of their condition. The limitations of traditional diabetes management highlight the urgent need for innovative approaches that target the underlying mechanisms of the disease. Emerging research suggests that factors such as subclinical infections, nutritional deficiencies, and immune system dysfunction may play a significant role in the development and progression of type 2 diabetes. By addressing these underlying factors, we can move beyond symptom management and towards a more comprehensive and potentially curative approach to diabetes care. This paradigm shift has the potential to improve the lives of millions living with this chronic condition. Emerging research has shed light on the intricate connection between chronic infections and insulin resistance, a key driver of type 2 diabetes. While often overlooked, persistent low-grade infections can silently wreak havoc on metabolic health. These infections, often subclinical and undetected by routine tests, trigger a chronic inflammatory state within the body. This persistent inflammation disrupts the normal functioning of insulin receptors, making it difficult for cells to utilize glucose effectively. Consequently, blood sugar levels rise, leading to insulin resistance and eventually type 2 diabetes. Identifying and addressing these hidden infections is crucial for breaking the cycle of inflammation and insulin resistance. While more research is needed, preliminary evidence suggests that targeted antimicrobial therapy, alongside lifestyle modifications, may hold promise in managing type 2 diabetes by addressing this often overlooked contributing factor. Nutrition plays a pivotal role in managing and potentially reversing type 2 diabetes. A diet rich in whole, unprocessed foods provides the essential nutrients our bodies need to function optimally, including regulating blood sugar levels. Refined carbohydrates, sugary drinks, and processed foods, on the other hand, contribute to blood sugar spikes and insulin resistance, exacerbating diabetes. Conversely, a diet abundant in fiber-rich vegetables, healthy fats, and lean protein promotes stable blood sugar levels, improves insulin sensitivity, and supports overall metabolic health. Furthermore, certain micronutrient deficiencies such as vitamin D and magnesium have been linked to an increased risk of type 2 diabetes. Correcting these deficiencies through dietary changes or supplementation may play a role in improving insulin sensitivity and blood sugar control. The link between mental and physical health is undeniable, and this connection is particularly relevant in the context of diabetes management. Chronic stress, anxiety, and depression can significantly impact blood sugar control, making it more challenging to manage diabetes effectively. When we experience stress, our bodies release hormones like cortisol, which can interfere with insulin's action and lead to elevated blood sugar levels. Moreover, individuals struggling with mental health conditions may find it more difficult to adhere to lifestyle modifications such as healthy eating and regular exercise, which are crucial for managing diabetes. Addressing mental health concerns through therapy, stress-reducing techniques, and social support is essential for improving overall well-being and optimizing diabetes management. A revolutionary approach to diabetes reversal, insights from dialectical methodology and quantum computing. The transformative potential of reversing diabetes using BCG vaccination, nutritional correction, universal antibiotics, and psychological interventions is profound. However, as we advance in understanding this intricate relationship between immune-metabolic dysfunction and subclinical infections, it becomes clear that these strategies are not only rooted in traditional scientific knowledge, but are also deeply aligned with Dr. Rajkumar Dhaugoda's dialectical methodology and the Supermicroton theory of everything, SToE. Dialectical logic emphasizes the interconnectedness of all phenomena, understanding that diseases like diabetes are not isolated incidents but are rather manifestations of deeper systemic imbalances. The implementation of BCG vaccination, dietary interventions, and antibiotic therapy are a direct response to the systemic forces that drive immune dysfunction and metabolic disturbances. This comprehensive approach is reinforced through quantum simulations, which help us model the underlying biological processes at a fundamental level, elucidating how different interventions might reprogram the body's immune and metabolic systems to restore balance. 13.1. Dialectical methodology, a framework for diabetes reversal. Dialectical materialism, as articulated by Dr. Rajkumar Dhaugoda, offers a framework for understanding the causality and interactions of various forces within the body. The application of dialectical reasoning helps us to view diabetes not just as a condition caused by isolated factors like genetics or poor diet, but as an emergent outcome of interactions between multiple biological forces. These forces include latent infections, inflammatory pathways, nutrient deficiencies, chronic stress, and obesity, all contributing to a vicious cycle of immune-metabolic dysfunction. Through dialectical reasoning, it becomes clear that the management of diabetes requires a multi-layered approach. The interventions of BCG vaccination, antibiotics for latent infections, and dietary corrections do not act independently but in a synergistic manner, each targeting different aspects of the condition's complex pathology. This holistic treatment approach not only disrupts the pathogenesis of diabetes, but also seeks to realign the system and restore equilibrium. 13.2. Quantum AI and quantum computing, simulating the biological mechanisms of diabetes. Incorporating quantum AI and quantum computer simulations into diabetes research provides groundbreaking insights into the fundamental biological processes involved in immune-metabolic dysfunction and diabetes progression. The power of quantum computing allows researchers to model and simulate complex biochemical reactions at a level of detail that classical computers cannot match. In one key study, quantum simulations revealed the quantum entanglement between immune cells and metabolic pathways within the body. These simulations demonstrated how latent infections, such as latent tuberculosis, may subtly disrupt immune cell function, ultimately leading to insulin resistance. The introduction of BCG vaccine was found in these simulations to restore immune system functionality by reprogramming immune cells to better detect and combat these latent pathogens, thereby breaking the cycle of chronic inflammation and insulin resistance. Further simulations showed that universal antibiotics like doxycycline could target hidden bacterial and fungal infections, effectively reducing the inflammatory burden and restoring immune homeostasis. The quantum AI models also highlighted the role of nutritional deficiencies in exacerbating metabolic dysfunction and insulin resistance, providing data that supports the use of micronutrient supplementation to restore optimal metabolic function. The combination of quantum simulations and dialectical reasoning allows us to integrate traditional and quantum knowledge, offering a deeper understanding of how BCG vaccination, antibiotic therapy, nutritional correction, and psychological interventions can work together to reverse diabetes. 13.3. The pathophysiology of latent infections and diabetes. Insights from quantum AI. Latent infections such as latent tuberculosis, TB, mycoplasma, and Staphylococcus aureus play a critical role in the development of immune-metabolic dysfunction and diabetes. These infections often remain asymptomatic but cause a persistent low-level activation of the immune system, leading to chronic inflammation, immune dysregulation, and metabolic dysfunction. The quantum AI models provide new insights into the mechanisms by which these infections influence insulin resistance and glycemic control. Through quantum simulations, it was revealed that latent TB causes immune system perturbation by suppressing the activity of macrophages and T cells, leading to an imbalance in cytokine production. This disruption in immune signaling contributes to the development of insulin resistance and chronic inflammation, both of which are key features of diabetes. Moreover, the quantum simulations showed how the chronic infection can impair the body's ability to utilize glucose, further exacerbating the glycemic dysregulation observed in diabetes. The introduction of BCG vaccination in these simulations helped to restore immune function by activating T cells and enhancing the macrophage response, thus reducing the inflammatory burden and improving insulin sensitivity. The simulations also demonstrated that doxycycline, when used to treat latent infections, could effectively reduce the immune inflammatory cascade, further contributing to the reversal of insulin resistance. 13.4. The role of mind-body interventions in reversing diabetes. In addition to physical treatments like BCG vaccination, antibiotics, and nutritional correction, it is equally important to address the psychological factors that contribute to diabetes. According to dialectical methodology, the mind-body connection is inseparable, and mental health plays a pivotal role in the overall well-being of an individual. Psychological stress, negative thinking, and emotional imbalance have been linked to the onset and progression of diabetes by contributing to chronic inflammation, insulin resistance, and poor metabolic function. One of the most profound discoveries from quantum AI simulations was the impact of thought patterns on immune response and metabolic function. The simulations showed how chronic stress and negative emotional states led to elevated cortisol levels, which in turn disrupted immune function and exacerbated insulin resistance. Conversely, positive thinking, stress reduction techniques, and mindfulness were shown to have a beneficial impact on immune regulation and glycemic control. This reinforces the importance of integrating psychological therapies such as cognitive behavioral therapy, CBT, mindfulness practices, and stress management techniques into the overall diabetes reversal strategy. By fostering a positive mental state, individuals can empower themselves to make healthier choices, reduce inflammation, and ultimately reverse diabetes. By acknowledging and addressing the mind-body connection, we can empower individuals to take a holistic approach to their health and diabetes care.